So I had a patient come to me last week, and she came in, great patient, comes in with like a nice little folder full of her PT exercises that she got from a physical therapist in California. They were all laminated and put into sections of her shoulder, hip, etc. All the different body parts that she needed physical therapy. And she was a little bit of an older patient, but it made me think about a couple of things, because she asked me, she said, "So can you tell me which one of these exercises I should be doing?" So instead of looking through all these exercises, because I'm sure you PTs out there have patients, and also you trainers have patients out there who look at these and say, have people that come to you with the same exact question. So take a quick poll. What do you say? Do you tell the person to keep doing all the exercises or not? So my answer is sort of a trick question. The only question that I ask, I don't even have to look at the exercises. I just ask them, do they still challenge you? Are they easy? If an exercise, PT exercises aren't always sort of small, kind of very thought-provoking kind of movements. Sometimes they're larger movements that need to be done that are specific to whatever specific sport you're doing or activity that you want to get back to doing. But ultimately, wherever you start in that progression, it should always feel challenging. Let's just take that as an example. Someone who comes in with a rotator cuff issue, shoulder issue, and they sort of get the classic, external rotation, blah, 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 which, by the way, is complete crap. Please don't always give people external rotation exercise. That's for now. If this is challenging for them and appropriate for them, then great. Continue to do it until it becomes easy and not as effortful, right? Is that a word? Every single exercise that you give your patients or your clients should challenge them appropriately, right? So obviously not flare them up, but not make it so easy that they could just do. The purpose of a physical therapy exercise, a home exercise program, is not to give a patient this sort of program that they stick with their entire lives, right? Like no matter where they are in their function, this is all they do. The point is to give them something that's appropriate for them at that moment in time. And then when it's time to progress them, you then progress them. And hopefully you will progress them out of these sort of small exercises or small movements that you're trying to get them to do in order to prepare them for larger, much more functional movements or activities. And then they should get to a point where they become independent. Or if you find that they're at a place where maybe they don't need PT anymore, send them to a personal trainer. Like send them to a running coach. Send them to someone who can take them to the next level. And please, don't give them 3 or 4 sheets of paper with this exercise and tell them to do that for the rest of their life. Because it's not going to help them for the rest of their life. It's going to help them this week. Maybe it might not even help them next week. So progression is the name of the game in physical therapy and in fitness. And as I always say, physical therapy is the bridge between medicine and fitness. Thanks for listening.